A suspected Ebola case has triggered heightened alertness in Kerala after a 52-year-old woman who recently returned from South Sudan was admitted to the Kottayam Medical College Hospital with Ebola-like symptoms. The woman reportedly developed fever, headache, muscle pain and a sore throat after arriving in India. Health officials say she was initially treated at a private hospital before being shifted to an isolation ward at the government medical college as a precaution. Samples have been collected and sent for laboratory testing, and authorities are awaiting confirmation. Kerala's Health Minister K. Muralidharan has urged the public not to panic, stating that all necessary measures are in place to handle any eventuality. The case comes amidst increased surveillance across India following recent Ebola outbreaks in parts of Africa. The Union Health Ministry has already issued alerts and strengthened the monitoring of travelers arriving from affected countries, including South Sudan, Uganda, and the Democratic Republic of Congo. We have my colleague Varghese Abraham now joining us on the phone. And Varghese, one case now under surveillance, but the fact of the matter is that Kerala is no stranger to these outbreaks, and the primary healthcare system is fairly well equipped to handle.
It was like it is the emergency response measure that has been put forward for Ebola that is underway, and they have in fact taken charge of it, and they have ensured that they in fact move towards in that direction, that is to identify the case, carry on with isolation and monitor the case, and also send in the blood samples for confirmation. So right now what we understand is that blood samples have been in fact taken from the suspected case, and the person's blood samples have also been sent to the Institute of Virology in Pune. So we are waiting the test results, which is expected to be given by 1 or 2 days. So then we will come to know what the situation is. There have been several such scares across India, especially when it comes to Ebola. In this particular case, the person has in fact a 52-year-old woman who came from South Sudan. She was in Pala, where she reported the first symptoms, after which she was taken to a local hospital there. From there, she has been referenced to the Kottayam Medical College, where the protocol for Ebola kicks in. Now, this is part of the procedure that has been prescribed by the central government when it comes to people who travel from African nations. This particular traveler, especially from South Sudan, after she reported these cases, had in fact followed with the protocol, thereby which she has been now admitted to the isolation room in the medical college. What we understand is that there's a round-the-clock observation of the person who was taking place. She had reported fever as well as sore throat, and after which the incident was in fact reported. As of now, there are no confirmed cases of Ebola in the country as of now. There have been several scares that have been reported in other states, but they have been ruled out after the blood test was carried out. And similarly, right now, the attempt is to, in fact, find out what the blood test carries. But now attempts are also being carried out to ensure that everyone who comes from the African nations, especially on travel or coming back as students, they follow this strict protocol as such. So clearly, as of now, the effort is into keeping the monitoring high and to ensure that no case slips under the radar and becomes a problem as such. So all the health department in the state as well as across the country on high alert for this.